Have you ever been ambushed by a sudden sharp toothache? Ever wondered what launches these painful assaults on your peace? Toothache, a common yet dreaded experience, strikes without warning, plunging its victims into relentless discomfort. This pain isn't just a nuisance, it's a signal from our body, urging us to pay attention to our dental health. By understanding what triggers these oral alarms, we can better prevent and address the underlying issues. Let's dive into the common culprits behind toothaches. First on the list, and perhaps the most notorious, is dental decay. Imagine your mouth as a bustling city where bacteria thrive, especially when they're fed sugars and starches from what you eat. These bacteria are not just benign citizens, they produce acids as a byproduct. This acid is more than a simple waste product, it's a potent force that gradually erodes the hard, protective surface of your teeth known as enamel. As the enamel wears away, tiny holes or cavities begin to form. Initially, these cavities might not be noticeable, but they set the stage for more severe damage. If unchecked, the acid continues its journey deeper into the tooth, reaching the softer dentin layer, which is less resistant than enamel. From there, the situation can escalate quickly as the decay approaches the innermost part of the tooth where sensitive nerves reside. Reaching this nerve can lead to sharp, piercing pain. So, maintaining good oral hygiene isn't just about a bright smile, it's a battle against decay. Next up, we explore how distressed gums contribute to toothaches. Gum disease, a common yet often overlooked culprit behind toothaches, primarily includes conditions like gingivitis and periodontitis. These ailments start quietly, often with mild symptoms that can easily be dismissed. Gingivitis, the milder form, manifests as red, swollen gums that might bleed during brushing or flossing. Without intervention, gingivitis can advance to periodontitis. Here, the inner layer of the gum and bone pull away from the teeth, forming pockets that can become infected. This progression is not just uncomfortable, it's painful. As gums recede, they expose the roots of your teeth. These areas, normally protected, are incredibly sensitive to temperatures and pressures, which can lead to severe pain whenever you eat or drink something hot, cold, or particularly sugary. Remember, healthy gums are the foundation of a healthy mouth. They support your teeth and protect them from conditions that could lead to pain. Taking care of your gums is as crucial as caring for your teeth. Sometimes the integrity of our teeth is compromised by cracks. It's not always the dramatic shattering that brings the pain, but often just a small fracture or chip can be enough to make you wince. When the hard outer layer of a tooth, known as the enamel, is cracked, the softer, sensitive inner layer called the dentin can become exposed. This exposure is a direct invitation for toothache. Imagine the dentin as the protective casing for the tooth's nerve. Once this casing is breached, even slightly, things like a sip of hot coffee or a bite of ice cream can trigger a sharp, penetrating pain. This happens because the temperature change reaches the nerve much more quickly and intensely without the insulating layer of enamel. Moreover, if the crack reaches the innermost part of the tooth where the nerve lies, the pain can become constant and severe. It's a clear signal that the protective barriers of the tooth have been compromised. Even a small chip or crack can open doors to significant pain. While decay, disease, and damage top the list, other factors also trigger toothaches. Let's delve into some less common culprits that might surprise you. First up, impacted teeth. These are teeth that haven't emerged properly or are blocked as they try to break through the gum. Wisdom teeth often fall into this category, getting stuck or growing at odd angles, potentially causing excruciating pain as they press against other teeth or bone. Moving on, dental abscesses, which are pockets of infection at the tooth's root or between the gum and a tooth, can also be agonizing. They often result from untreated cavities, gum disease, or a cracked tooth. The pain can be persistent, throbbing, and can cause severe discomfort when eating or touching the area. Lastly, let's not overlook sinus infections. These can lead to pain in your upper teeth since the sinuses are located just above the dental arch. The pressure from a sinus infection can cause an aching sensation that feels remarkably like a toothache. A range of issues can lead to tooth pain, highlighting the need for comprehensive dental care. Now that we've uncovered the primary provocateurs behind toothaches, what's the takeaway? Tooth decay, often from sugary diets and poor dental hygiene, can deeply damage teeth. Gum disease stemming from neglected gum care also plays a pivotal role. Don't overlook physical damage. Cracks and fractures are formidable foes. And remember, various other factors like sinus infections or misaligned teeth can contribute too. Regular dental checkups and maintaining good oral hygiene are essential defenses. Remember, understanding the enemy is the first step in defeating it. Keep your teeth healthy and keep those toothaches at bay.